Can an early endometriosis diagnosis improve life quality? Have you ever wondered if getting diagnosed with endometriosis early can actually make a difference in your life? The answer is yes, and here's why. An early diagnosis of endometriosis generally improves quality of life by enabling better symptom management, slowing disease progression, preserving fertility, and reducing emotional distress. When endometriosis is detected early, it allows for timely interventions that can lessen pain and improve overall well-being, especially regarding fertility. Endometriosis is a chronic condition where tissue similar to the uterine lining grows outside the uterus. This can lead to pain, inflammation, and sometimes infertility. Diagnosing it early has several important benefits. First, it helps with improved symptom management and pain reduction. When patients and healthcare providers can address symptoms proactively, it leads to reduced pain intensity and better physical functioning. This proactive approach can prevent the prolonged suffering that often comes with a delayed diagnosis, which historically took years due to reliance on invasive surgical confirmation. Nowadays, non-invasive imaging techniques like transvaginal ultrasound and magnetic resonance imaging can facilitate earlier detection of lesions, allowing for earlier symptom control measures. Another significant benefit of early diagnosis is the prevention of disease progression. Detecting endometriosis in its initial stages can slow or halt the growth of endometrial-like tissue outside the uterus. Early treatment can reduce the formation of adhesions, which are scar tissues, and ovarian cysts. These complications can worsen symptoms and affect fertility outcomes. By preserving reproductive organ function and overall pelvic health, early detection can make a big difference. Preservation of fertility is especially crucial since endometriosis often affects women of reproductive age. Early diagnosis allows for timely interventions that can improve the chances of successful pregnancy, minimizing damage to reproductive organs and allowing for earlier fertility treatments, such as assisted reproductive technologies, can be vital. Additionally, early diagnosis empowers patients to make informed reproductive choices sooner. Moreover, patients diagnosed early have a wider range of effective treatment options. This includes hormonal therapies, medications, physical therapy, and less invasive surgeries. Early-stage disease is generally more responsive to medical management, which can reduce the need for more aggressive interventions later on. Lastly, let's not overlook the emotional and mental well-being aspect. The uncertainty and chronic pain associated with undiagnosed endometriosis can lead to anxiety, depression, and feelings of isolation. An early diagnosis provides clarity and validation, empowering patients to understand their condition and access support and treatment. This emotional relief significantly contributes to improved quality of life. However, it is important to note that some research suggests that quality of life improvements after treatment may occur regardless of whether diagnosis was early or late. This indicates that treatment itself is key to symptom relief. Still, earlier diagnosis generally allows for better preservation of fertility and prevention of complications, which indirectly supports improved life quality. In summary, from a fertility and endometriosis perspective, early diagnosis is beneficial. It enables timely symptom control, preserves reproductive potential, reduces complications, and supports emotional health. If you are experiencing symptoms suggestive of endometriosis, it is essential to seek professional medical evaluation to optimize outcomes through early intervention.